right, now to a big story on the COVID-19 front. We're continuing to talk about it this week. Harris County raising the COVID threat level from yellow to orange.
Yeah, it comes as the Delta variant spreads throughout Houston. The threat level is based on a number of metrics, including case numbers, hospitalizations, and positivity rate. County Judge Lena Hidalgo urged everyone who can get vaccinated, and she made this request.
We're asking everybody to wear masks.
Delta variant, this is far more transmissible than anything we've seen before. It's far more contagious.
Well, the spike in cases here comes as the Delta variant takes a toll nationwide. The White House task force says 40% of all new cases in America this week came from 3 states, Florida, Missouri, and right here in Texas.
And many people are struggling with the after effects of COVID-19 for weeks and some even months after they first got sick. And research now shows that this is twice as likely to happen if you're a female. Joy Vonk used to do Ironman competitions until a 2-week bout with COVID that she caught while she was working in Kenya. She had to be medically evacuated back to the U.S. 5 months later, she is still short of breath and doing therapy 3 times a week.
And thought, I'm being really careful. I'm doing everything I'm supposed to do. And I would have taken the vaccine in a heartbeat had it been available before I left. I still got sick, and I don't have any chronic health conditions, and I got really sick.
Vonk is getting better every day, although the physician's assistant that we spoke with says the slow progress can be discouraging for many patients.
Now to your coronavirus headlines. 3 things that we are watching for you this Friday morning. Counting down from number 3, new research shows nearly half of all ICU doctors and nurses worldwide have suffered mental health issues from that pandemic. Now to number 2. Pediatricians have seen a spike in severe cases of type 2 diabetes among young children during the pandemic. Experts believe fewer wellness visits, poor diet, and less exercise during lockdown are all to blame, bringing us to number 1. A CDC panel says the benefits of the one-shot Johnson & Johnson COVID vaccine outweigh the risks of developing a rare brain condition. Meanwhile, the panel will leave any decisions on booster shots to the FDA. And Steph, with the increase of COVID cases, many people are thinking about putting that mask right back on.
That's right. Health experts, in fact, are calling for a mask mandate, but could that actually happen? Stephanie Whitfield connects the dots.
Increases in COVID cases and hospitalizations has some health experts calling for the return of face masks. So will the CDC change its message on masks? Let's connect the dots. Back in May, vaccination rates were high and case counts were low. The Center for Disease Control declared it was safe for fully vaccinated people to toss their masks in most settings. We all know what happened next. Vaccine rates slowed down and the Delta variant hit hard. Health experts say the CDC decision was backed up by science, but unfortunately not human behavior. That led to unvaccinated and unmasked individuals fueling the spread of the contagious Delta variant. Now, White House Chief Medical Advisor Dr. Anthony Fauci says fully vaccinated people might want to consider putting the mask back on. While the vaccines are effective, they don't offer 100% protection. Dr. Fauci says if the vaccinated want added protection, they can wear a mask indoors, especially in crowded places. Despite that new recommendation, experts say it's unlikely there will be a nationwide mask mandate because the pushback would be extreme. Instead, with 99.5% of all U.S. COVID deaths now being unvaccinated people, the focus will be on more people getting the shot. Connecting the dots, I'm Stephanie Whitfield, KHOU 11 News.